We're now ready for our panel discussion on leading indicators. Our panel includes Matt Shurtliff, president of Shrike Solutions LLC here in Omaha. Matt has more than 30 years of experience in the safety, health, and environmental field. Over his career, Matt has developed and led solutions on a wide variety of safety issues, including cultural transformation, risk management planning, risk assessment, program development, performance management, incident investigation, and COVID response. Matt has been a lead contact and negotiator for OSHA, US EPA, and multiple state and local regulatory agencies. Our second panelist is Brian Wanzenried, Director of Environmental for Gavilon here in Omaha. Brian has over 30 years of experience in chemical and environmental engineering, including environmental regulatory compliance, safety and industrial hygiene, training, site assessments and cleanup, natural resources, security, and transportation. At Gavilon, Brian oversees the environmental programs for over 100 grain and ingredient facilities throughout the United States. Our third panelist is Brian Grimm, Safety Director for Bartlett Grain Company in Kansas City. Brian is responsible for directing and managing Bartlett's safety, health, and environmental programs. Prior to joining Bartlett in 2002, Brian was plant manager for ADM Milling and operations manager and re-engineering specialist for Mormon Manufacturing. In these roles, Brian was responsible for feed mills, flour mills, grain elevators, vitamin and premix operations, fabrication shops, and feedlots. Brian is an active board member for the Grain Handling Safety Coalition, and this session will be moderated by Jim Seibert. So Jim, I'll turn it over to you. Thank you.
Good morning, everyone. Very good to see your faces. Jim Seibert, I'm the Director of Safety Education and Training for the Ngfa, and I was hand-selected to moderate this event right here. I am a believer that it is better to keep your mouth closed and look like a fool than to open your mouth and remove all doubt. However, these panel discussions are much, much better, more enjoyable for the panelists, and for me when there's a lot of interaction from the crowd. So I have a list of questions over leading indicators, and your questions are going to be much better. So shout them out, raise your hand, and I'll say it back to you to make sure that I heard it, because I'm a 20-year field artillery officer, and for some reason I can't hear my wife, but I can hear everybody else. So, kicking it off with question number 1. What are leading indicators?
Can you hear me okay? So I'm Matt. Really, there's a lot of different ways to describe them, but the way that I really simply describe leading indicators are what are the things that we're doing out there to prevent injuries from occurring? An injury is a lagging indicator. That's the thing that we don't want to have happen. And of course, looking at that information has value to us from the perspective of root cause analysis and all. But leading indicators are what are the things that we're trying to do to prevent injuries from occurring. And for me, that typically boils down to injury risk. How are we identifying injury risk, and what are we doing about it once we do identify it?
All right, 5 points awarded to Matt. Would you like to cover this slide real quick over a sample of lagging and leading indicators?
Sure. One of the ways I like to describe leading indicators is to differentiate them between the other indicators that we commonly use, lagging indicators being one of them. In our field, those are likely your incident rate, total incident rate for OSHA, number of accidents you've had, number of fires, explosions, spills, releases. These are all what we call lagging indicators. The best example I've seen is simply for an automobile. If you were using lagging indicators to track how efficient or good of a car you have, the number of flat tires would be one indicator. A number of times it won't start, you have to jump it. A number of times it simply breaks down. Those are all lagging indicators. And we tend to use the total incident rate in the safety industry as an indicator, but it's an odd indicator if you look at it from any other perspective. Normally we use leading indicators, like for our cars. You would look at how many times you've rotated your tires or replaced them. When it won't start, you want to instead look at how frequently you've replaced the battery or tested it. And for breakdowns, instead of how many times it breaks down, you'd use the leading indicators, like how many times you change the oil and get it tuned up and check the car.
Thank you. Mr. Grimm, what are the benefits of using leading indicators to prevent worker fatalities, injuries, and illnesses?
So, again, the way I look at it is, what are the things that we want to do, and what are the things we know we have to do well in order to, again, lessen the chances of injuries or incidents. So if you choose items and you know these are the tasks that you have to do, you're going to do them well, you're going to, even if there is an injury, it's going to be a minimal type outcome. So by tracking, let's say, for instance, observations, are your team members doing the jobs properly, you're going to have less of a chance of, like you say, a fatality or a different type of severe injury. So if we do these things well, we're just simply not going to have those events, or they're going to be of such minimal nature that it's not going to totally change the course of our business or harm our team members.
So kind of for open discussion amongst you gentlemen, how are your companies using leading indicators to improve their safety and health programs?
I can start with some things I've worked with in the past. I mentioned that really, in my opinion, safety is about managing injury risk. And so you can use leading indicators to identify or to guide you with things like how much risk am I able to identify? How often do we go out and look through our sites? Do we look through our sites to try and determine hazards? I think the next panel presentation is going to be talking about that. That's a leading indicator right there, because you're going out looking around trying to physically identify risk. So how much risk do you look for? How much risk do you find? And then what happens to it once you identify it? So those are the three leading indicators right there. We would, in a previous job, we would have called those hazards identified, or hazard ID walks performed, hazards identified, and then corrective actions identified and completed from the hazards. In addition to that, in my past, we've looked at things like audit results, and then maybe a few others. Maybe you can share what you got going on at Bartlett.
I was going to say, one of the, when you look at risk, one of the high-risk areas in all of our business is unplanned activities. So breakdowns, it's really breakdown and mechanical issues, or it's a one-time job. We're not doing it routinely. We might be using equipment that we're not using every day. So from a leading indicator, we look at our preventive maintenance. So preventive maintenance done on time, quality of preventive maintenance. So we actually go out, we have an individual that goes audits the preventive maintenance at each facility to make sure that the team member knows what they're supposed to be doing, that they know what to do, the correct procedures, that they're actually doing it, and they're following the absolute entire checklist. So by auditing the quality of the preventive maintenance and the frequency and the completeness of the preventive maintenance, we can then eliminate the number of breakdown activities that we have, which then eliminates the risk of those one-time maintenance activities. So we measure, again, by proactively measuring those preventive maintenance activities up front and the quality of those preventive maintenance issues up front, we could then eliminate those risky behaviors at the end.
So Your example. I'm sorry.
You
go
know,
ahead.
Jim, I think this all kind of folds well with some of the points we heard from Jim this morning in the previous presentation. Just some things I jotted down that I thought fit really well into leading indicators. Were it was just one of his points he hadn't read. Incidents or risks that have materialized. And so what we're trying to do with leading indicators is identify those risks and get to them before they materialize into an injury, essentially, just like you described. And then as Jim went through and described a lot of the activities that were performed in response to the incidents, he was able to identify things that do turn into leading indicators. You know, when you talk about having new visions, setting new goals, evaluating for improvement and innovative new approaches, leading indicators are the things that allow you to measure those new approaches, those things that you're trying to do to prevent the bad thing from happening. Because you can't manage something by hoping it doesn't happen. And that's what managing injuries by an injury rate is. You know, you can't manage by hoping to measure nothing.
I'm feeling a lot of overlap from Jim all the way to the next panel that we're going to go over hazard assessments. And I don't want to steal the thunder from our next panel session, but Brian, I like your comparison of how you use the leading indicators specifically when referencing your preventative maintenance program or your PMCS program. Well, just comparing the two real quick, is there a line between leading indicator studies and hazard assessments? Do you guys take a different approach within your companies? Are they treated the same, or do you have you separated a program that is a leading indicator study, where you've got a list that you're going to go down and check off, where a hazard assessment could be tied to some regulatory things that are an annual basis, or are they treated the same and kind of underneath the same department?
That might be an interesting question for some folks, for anybody in the room, to tell you the truth.
I like where your head's at.
Yeah. I can think of one.
Anybody want to fall on the sword? Again, I've taken the role of looking like the fool, so questions are good.
So, Jim, can you clarify that question again? I'm sorry.
Yeah, so we've seen this overlap, right? We've referenced Jim, failing to plan is planning to fail. And hazard assessment, we think about our audio, sound, our dust, confined space entry or bin entry, and we look at how we assess hazards that are known in a focal point within our industry. This leading indicator seems like we're taking a very, very proactive approach at looking out into the distance, and your reference on maintenance was excellent. Do you delineate between the two in your company, or do they roll up under your assessment program and how you do them?
Focus on where we have to improve and install those
And the lagging indicators, I mean, in reality, you can't hide from the injury numbers, but a lot of times they do show how well your leading indicators are working. Exactly. I mean, they are a measurement to your leading. So from a hazard assessment, we've got a lot of data showing the amount of time that particularly me and the assistant, the number of visits that we make, the number of proactive visits we make, the number of proactive communications we're having with team members. The findings that we're finding in our facilities, if we plot that versus our accident rate, there's a direct correlation. So, and we've seen it over time in the history where, let's say, we've been pulled out of the field, then you see an injury rate go up the following year. When we go back out into the field and we're having all those proactive communications, proactive hazard assessments, then we could, we pull that injury data back down. So I mean, we do see a correlation between, again, us being out in the field and hazard identification and positive communication driving incident rate. We've got great correlation on that.
And it is important, most of the reading I've done on leading and lagging indicators, it talks to the fact that you don't give up on looking at the lagging indicators, as Don mentioned. And I do think it's important, unless you happen to guess perfectly at what leading indicators you're going to use, you might need to adjust. You may have selected the wrong leading indicators, or the hazards might change, the risks might change, and you end up having to switch which leading indicators you're using. So I'd love to say I got them right the first time, but that's not the case. It's you're going to have to keep looking at them and decide, are these effective, and have we selected the right leading indicators for this situation?
I think you make a really good point there, and Don, you kind of made it here just a minute ago, and Jim said so earlier today. You want to target areas of greater opportunities, and that's where your lagging indicators are going to tell you sometimes where your greater opportunities are. One thing that you can look at is, people can debate whether or not it's a leading or lagging indicator, but you can take a look at your near misses and see where exactly your near misses occur, and you can design leading indicators based off of the information that you have. You could do the same thing with something like, say, slip, trip, and fall data. Where are areas in your plants where you're seeing, or what types of situations are you seeing, say, slip, trips, and falls, and you can design leading indicators off of that. Things like inspections that you can make, and they can, the numbers of those inspections could become a leading indicator for you.
Thanks, Dawn. So the next question, which you guys have just kind of talked about a little bit, was describe how you've successfully chosen effective leading indicators. Would you guys expand, maybe share some examples of how you thought you were choosing the right leading indicator and it turned out that it was the wrong one? Are there any specific examples, or should we move on?
I could tell you the leading indicators that we tend to use are based around training, preventive maintenance, audits, and interviews. So, and there's a quality factor then that comes in on each of those measurements. So even though we're measuring, let's say, training compliance, you always have the risk of, as a manager, phoning it in. Is it really quality and effective training? So that, there's one gap there where we have to use other methods to identify that. But again, training compliance is definitely one of the leading indicators that I'm sure we all use. Preventive maintenance compliance, that's number of tasks completed on time, number of one-time work orders, which is, can also be an indication of breakdowns or hazards identified. We like to measure number of hazards identified and then the timeliness of those completions. But within number identified, we'd like to know, kind of what's identified by us safety staff versus organically identified within the facility by the team members themselves. And that's a great measurement, because then that also measures worker participation. Auditing, so we go out and we have significant facility audits that are done by the location management, then also by us. And again, that shows a trend that we could identify before we have a problem. And one of the most important things that we do are team member interviews. We can interview every new hire that we have within their first few months of employment. And then we also run those same list of questions by our experienced workforce. And we could look at the difference in data between those two sets of interviews to show where our gaps are with the new team members. So we use that data as a leading indicator to show maybe weaknesses in our workforce, weaknesses in our training, and we use that then to guide our next set of actions to eliminate hazards.
Yeah, I think that's a good point that you make, and I liked it enough that I borrowed it from you, if I remember right. Interviews with new employees. It's a great opportunity to, first off, just face-to-face have a safety-driven conversation with new folks. You learn a lot. You can learn where the holes are in your own training. And that's the most important thing. If a person gives you an answer that's not the answer that you're looking for, you have an opportunity to correct that hole in your training right there. And anyhow, I think I've found that to be pretty valuable.
Well, you gentlemen have effectively destroyed my list of questions by answering everything before I got there. So how do you track the progress of your leading indicators? What is, I've heard the reference of the reports, and maybe it's feedback from your employees during that interview process. But what tells you that you're doing it right at the end of the day?
Well, you have to. Sure. Go ahead. Yeah, you have to find a way to count them, whether you're using a spreadsheet or you have some type of information management system. But in the end, like with respect to audits, if you're talking about an audit, you want to be able to track the answer to each audit question, and you want to be able to track an overall score. That'll show you each individual questions will help you identify, again, it's kind of like you're looking with a searchlight through your programs, and you see something that lights up and it's a hole and you see it across multiple locations. So you want to be able to look at individual things that you're looking at. You want to look at an overall aggregate score, and you want to be able to look at your whole company, I guess. I don't know, was that sufficiently vague? Did I make it more vague or less?
It's good for me.
Is it?
I have more questions, but let's just take a pause. Is there any comments or questions?
And I'll speak to that a little bit. That's a great point. And if I'd have done it over again, we were rushing to get something out and threw together our leading indicators, and I think they worked well, but it would have been a lot better if we'd have solicited input, got that employee participation, and got them to, because we would have gotten better buy-in and maybe better understanding of that. And additionally, I think this will not be effective at any organization unless you've got leadership looking at the numbers and commenting on them and supporting that.
Some of the key leading indicators are going to be directly measuring worker participation and team member engagement. So those are two very important measurements to have built into your leading indicators, because if you have, again, that organic participation at the ground level in your safety program, it's going to be a much more successful outcome at the end. So again, we have, or I should say, I specifically track certain points that measure those two things, just to see how much. Again, I'm not the safety department. I'm not in the safety program for our company. It's our team members. And so tracking that involvement is critical as well.
Yeah, personally, I think for the biggest success story that I have is finding and fixing hazards is a big deal. It measures, like we said, it measures employee participation. It measures our facilities' ability to go out and see hazards. Have we taught our folks well enough to go out and identify hazards? What happens once they're identified? They get on a list. Do we get them taken care of? And once they're taken care of, that's risk mitigated, and that's a huge deal. And so that's a very specific, very positive result. And kind of going back to the beginning, what I was talking about. Safety is managing injury risks. So if you've got ways that you can track direct mitigation of injury risk, that's a huge and positive leading indicator. Go ahead, Jess.
No, I got a couple questions.
Well, feel free to interrupt. Go ahead.
I'll just throw it out there. The two different are OSHA related, right? So you're talking lagging indicators and leading indicators. So OSHA citation is a lagging indicator, right? You had an incident that occurred, you get a citation. They're telling you you're going to have to mitigate changes because of the citation, whatever the subsequent may be, right? So how do you correlate what happened with the citation incident with a leading indicator, right? We have this leading indicator program. We had an incident that occurred. We're going to have to do this to address the hazard. So that's number one. And then number two would be, I know OSHA also has a leading indicator, I don't know if it's a guidance document. It's more just kind of an informational document. I know we'll be posting the resources that Brian provided. Can post that up there too. But how does that document related to the leading indicators correlate with, say, you get a citation? So I'll just throw it out there for y'all to.
Yeah, well, he talks fast. Thanks, Jess. The point one is an OSHA citation. It's a lagging indicator, and so you can take that back, do an assessment over it. And then the second point was about flyers or safety fact sheets provided by OSHA, and taking that back and using that to kind of help kick off a leading indicator, using as a leading indicator at your facility. And then also there is a stack of references that we'll get up on the screen that can help you guys, folks, dive into a leading indicator study. So that's, did I nail it? Okay.
I can address that first one. So, doing the root cause investigation, like Jim had mentioned earlier, and then assigning action plans to me are what I think are the best leading indicators. We never hit a site or facility or somebody for having a violation necessarily, or an injury, accident. But if we don't correct it, and correct it at a certain time frame that we've established, to me that's just worse than even knowing that it happened. So that's one of our big action plan leading indicators, is completing those on time.
OSHA does talk about, again, shifting to and transitioning to leading indicators, but one of their core programs is the site-specific targeting, which is based 100% on lagging indicators. So I always get a chuckle out of that, how those don't align necessarily, but they do. Again, they have a great publication on leading indicators, and they give sample leading indicators on management leadership, worker participation, hazard ID and assessment, hazard prevention and control, leading indicators on education and training, communication and coordination. And then one of the more important ones is program evaluation and implementation. So again, it doesn't matter how great of a program you have if you're not, saying what you do and doing what you're saying. So that's an important part of it as well. What else? And then there's another documentation that OSHA does have that is recommended practices for safety and health programs. Again, if you bullet point that out, it's a couple hundred individual checklist items that they say are good for an effective safety program. Let's say you believe in 180 of the 220 points. That's great. Use that as an indicator as maybe you agree to implement 10 of these principles in the next year, and then 10 more. Use that as a scorecard to track improvement of your program. We found that very useful, and again, proud of the items that we have implemented. And I'll tell you, there's some on there that we will not implement, and that's not bad. It doesn't mean you have to do all of them, but just improve your program somehow. And again, if you use that as a scorecard, you can track some progress, and you know what you need to be doing. The more of those things that you do, the more successful your results are going to be.
So pretend for a moment that you are deeply inspired by this session, okay? And you go back to your facility and you are on fire for starting up a program, going after leading indicators from the crowd. What hurdles are you creating in your mind, one, that may or may not be there, to the acceptance of this program? And what hurdles do you know will be present going into it? Yes, sir.
I think one hurdle that we're currently experiencing is the gathering sharing of data. And so it's one thing to identify your leading indicators, the hazard identification, the conflict prevention, hazard identification, hazard investigation, the training, et cetera. But now you have this mountain of data coming in, and then how do you efficiently gather that data and then dashboard it somehow, so like monthly, year-to-date totals and so forth, and share with upper management so these sort of for this, and pointing out that location or even supervisor that's having them glaring leading indicator issues that we need to tackle now before they become enlightening. And so that's where our current struggle is why don't we do with all this data, how do we effectively share it, and who with actually take action on these things. And appreciate any thoughts on that.
Well, I think that can be one of the biggest challenges. Is we talk about the leading indicators, and I know when I did a presentation on this previously, it's like a lot of people had questions on, okay, what do I do with these leading indicators? And if you have a lot of tracking systems already in place, that makes it easier to gather the information and compile it, but it also, what I recognize as an issue, it makes it too easy to just bring in so much data that it's really complicated and no one really understands how you come up with the numbers you come up with. The other side of that is if you don't have these systems for bringing in the information, you really have to leverage how much time and manpower you have to compile this data. And explaining it is one of the most difficult things, I think. Trying to do math and tell people how you came up with these numbers. We basically just go on a percent complete basis, but we wanted to roll that up into one big number, so it got very complicated, and it's a little difficult for people to understand. I don't have a great answer to solve that other than maybe cut back on the number of parameters you're looking at.
One thing that I would recommend, so I've seen this problem. I remember I remember dealing exactly with this situation. That was, but one thing that you're going to need to do, in my opinion, is come up with a way to prioritize the data that you're looking at. And the best way that I can think of to prioritize it is to determine the risk associated with the hazards that you found. I mean, you can go out and you can find, depending on who's looking and how, if you have, say, a team of people going off and looking for hazards, you can go out and you can find yourself, 200-300 hazards if you're really looking hard at a facility. But what you want to be able to do is identify the ones that have the most potential to cause injury. So that brings it back to risk. So if there's a way that you can score the individual hazards with a risk, that's what I've seen work in the past the best. And you can do that based on severity of the injury that the hazard would cause, and then also the probability that something would, that the injury would happen would be. So anyhow, that's the best answer I have, speaking as somebody who's been sitting there looking at that mound of data.
I'll add and talk about hurdles. And, there's many times we can address risks in different manners, but there's sometimes it's going to cost money.
That's right.
Sometimes that we identify something we have at a facility, and we just can't eliminate it. It's something we have to do, and there's going to be cost involved. And when you're involving your employees and they identify something like this, it's really important that we act on it. And so to me, this is a communication piece from the top down. When we're putting in these types of programs, we have to make sure our VPs, our profit center managers, everybody realizes that, hey, there may be some times that we have to take corrective action that was not in our budget because this was identified, and we cannot find a proper workaround. There could be dollars involved, and that can be a hurdle sometimes. And that's a piece that has to be communicated, because once if your employees feel like, oh yeah, they want to talk about it until it's going to cost them money, and then, well, we'll look at this down the road, it can have a negative effect on the program.
That's an excellent point. Yes, sir.
You guys talked about the importance of evaluating employee buy-in, which I agree 100%. But perhaps even more important is, how do you evaluate management buy-in? Do you have any indicators that would give you an idea? Is that management team just giving vocal, or are they really supporting the program?
We've looked at, site visits by management personnel, counting that, as well as, talking points when we have them come on and they give an environmental health or safety topic during a conference call as types of ways to get leading indicators measured for management.
I can tell you in the OSHA document, they have a section, leading indicators showing support for management leadership, some suggestions that they have, kind of average score on survey questions related to workers' perception of management, number of times each month that top management initiates discussion of a safety topic, the time for management to respond to identified hazard, number of safety-related line item budgets and percentage of these funded each year. They have, different things also there. We like to, again, we feel it's so important that we have, our top management out in the field and initiating safety discussions with the team members. I know that's a new measurement, and it's a new OKR measurement this year for the organization, is getting those people out in front of the team members as well. So that is hugely important.
I think what you just described, Brian, and just having a new measurement in place goes to the trial and error element of, the trial and error element of leading indicator development. You aren't necessarily going to use the same leading indicators for the full duration or for years and years and years. Your culture is going to hopefully grow and change to the point that's going to allow you to use different leading indicators at different points in time that allow you to target specific things that are out there. I think just to echo what both of you guys have done, I've seen success with leading indicators that target senior management participation in site inspections. That's huge. It's huge for people to see their senior leadership out there and working with them side by side, trying to identify hazards. That's an observation of mine.
It's a great question, by the way. Thank you.
Yeah, I'm not sure if any of you use some of the engagement survey, some of the tools that are out there, both management and operations employees.
I know our company uses an engagement survey. There is limited questions based on safety. In fact, I'm supposed to, today or tomorrow, I should be getting all the comments back, anything related to safety, and it is something, we take to heart. I also understand there's safety engagement surveys that focus solely on safety, and they've been extremely valuable, and I know multiple companies probably in this room that have used some of those and have shown great value. And again, it's a numerical score per question, so you can pick one or two of those questions to focus your activities on proactively, and you should be able to measure that then, if you're improving in that area going forward. So it is a great tool.
So I've written down 3 hurdles that I've heard so far. Gathering and sharing of the data, the efficiency of that. And then once we have the data, how do we use it? So that's hurdle number 1. Hurdle number 2 was, okay, if you're saying it, you got to back it up. And a lot of times there's a monetary impact involved with that. So if something's identified, backing up the program. And then the third was management, employee/employee buy-in. I feel like those are probably shared hurdles in everybody's mind when thinking about rolling out a program, starting something new. And so I'll ask one more time before I ask this group the final question. Any other hurdles that we can think of? Gavin.
Once you start the program, have it established, how do you keep it from getting stagnant, keep it spiced up to where you keep getting the involvement and keep getting quality involvement instead of just checking a box? Any thoughts on that?
In my opinion, the best thing you can do to keep it spicy is as Don raised this point, as employees identify risks, that they see something happen to the risk that they're identifying. That has been, I think, the single best thing to building kind of ground level employee engagement that I've ever seen develop.
And we just have to keep increasing the team member involvement from the lowest level up to try to keep it as fresh as we can. And we've had so much work to do and we've covered so much ground. We keep changing enough that we've not necessarily run into that part yet. And I know it's coming at some point.
And we're looking at refreshing, getting some employee involvement. But it's a good question. It also leads to the concept of what do you do with the numbers? Do you hold people accountable? And is it part of their performance evaluation? Is it part of a bonus? I've read different views on that. Some will say that you need that so that people pay more attention to it, and others will actually say, well, if you do that, then you risk people just checking the box or A good example I read was that, you know, if they had to complete all this training, well, if they then shortchange the training because they're rushing through it to make sure they check all those boxes or not. So I don't know if there's a right or wrong. It's more of a philosophical issue, but that, you know, that does help if they are, means the leadership is looking at it and people are going to pay attention to it and hopefully continue to pay attention to it.
I just noticed on the prompter here that behind me the references are now up there. This is a good starting point to learn more and study up on. Let's pretend that you three were at your companies the moment that you started the leading indicator initiative. Okay, you were there at the very beginning. And let's assume, and I'll wear both hats when we assume on this one, but let's assume that we've got a company or a couple companies out here that have not started this program. What would you do differently if you were rolling out a leading indicator program from the start? What golden nuggets of information, where you are now compared to where you were at the beginning when you started? How would we get these folks started down the right road?
I mean, that's a tough one.
It is.
I mean, some of the leading indicators, again, let's just say training compliance. That's, we know we all have that.
Oh, that's an early and obvious one.
First of all, you just got to get an accurate measurement to know your starting point. That's the first thing, and get people to believe that that is your starting point. And then, again, once we had a good, again, since we have an SMS system, we have a good way of measuring that compliance. But that has become so important. Just like with any safety program, there are some cardinal rules. And with us, safety training is one of those cardinal rules. So our measurement soon got to where our measurement's 100%. So, you know, and we draw that line in the sand on a quarterly basis, but, you know, we try to maintain that at all times. But, you know, come January 1, come April 1, it's 100% compliance kind of, or else. You know, any exception has got to be explained. You know, the guy's out on military leave. Maybe the person has job restrictions where they can't climb a ladder, so we can't have them get on top of a rail car at that time to finish that training. But you know, there are some cardinal rules and some cardinal measurements in ours, and I think that's important as well.
I would say, in answer to the question from my experience, going back to that moment in time, is being able to communicate to senior management what you expect to happen if, quote, this works, unquote. You know, if, you know, I'm thinking back to the risk vision, and if we want to set off on a world where we can identify a bunch of hazards across our facilities, well, what's that going to look like? And we saw that hurdle. That hurdle's been identified here. You know, so what happens when we go off and start finding a whole bunch of hazards where something needs to get taken care of? Are we prepared as a group to manage that? How are we going to do that? If I had to go back in time, I'd like another crack at that apple.
And that's like point one, getting leadership to buy in, and that, I think, it's a great way to do it. If you don't do that, then you're probably wasting your time. But after that would be the first step I would do, followed by getting employees to come up with a list of what they think are good leading indicators.
That's a great point.
And you can come up with examples from these references here to show them, because it's kind of a little bit of an abstract concept. But after they come up with a list, then it's a matter of looking at those and trying to figure out, okay, how could you track them? Because some of them might not be, if you don't have a system in place, it's going to be a record-keeping nightmare. It's going to be a lot of work. So figuring out which ones you can use to track, and then figure out how are you going to compile this data and present it and explain it to people.
And with management expectations, I meant when you kick off things like worker participation, worker communication, hazard identification, again, you are going to have increased expense as you're finding and fixing hazards, and you may have an upward trend in injuries that year because people are reporting more things that maybe they weren't reporting before. So, setting that vision out, like you say, and sticking to it for the long run, because you're trying to measure things, again, that if we do these things, if we do them well and we're successful in doing them, our program and everything else is going to follow right along, and we know we're doing the right thing to reduce that risk profile. So you got to have that buy-in from the beginning.
Last call for questions or comments. All right. Well, thank you, Matt, Brian W., and Brian G. Very informative. Thank you for sharing your experiences with us.